Let's turn to Dr. Peter Chin-Hong. He's a professor of medicine and infectious disease specialist at University of California, San Francisco. Peter, nice to have you with us. Let me start with what's happening in this country, in the U.S. right now. Some glimmer of hope. 70% of U.S. adults have now at least had one shot of COVID-19 vaccine. A month later than President Biden had hoped, but still it did happen. Is this perhaps a game changer?
It is not a game changer, Asieh. It's a game changer metaphorically because every American that we get vaccinated is a step in the right direction. But we're dealing with Delta now, not Alpha, not the Wuhan variant, and the rules have changed. We need to have, at the minimum, 85% of individuals vaccinated. Sure, some folks may get immunity from natural infection given our surge now, but that immunity would be probably short-lived and will not be enough to stand up to the next variant after Delta.
I'm sure you already know this. A lot of states and communities are struggling in Florida, in Texas, Louisiana. Things are really bad there. A lot of people are ending up in the hospital. Hospitals overwhelmed. Who are the people who are ending up in hospitals? Tell our viewers, please.
The answer is simple, but it's tragic for me to say. The answer is it's the unvaccinated individuals. 99.99% of the cases in the country that have been hospitalized, that have serious disease, that require ventilation, they are unvaccinated.
What are the chances for those of us who are vaccinated, we can end up in the hospital hooked up to oxygen?
Very, very low chance. We've been, people have been seeing a lot of press about breakthrough cases of infection, but I want to distinguish in the audience between what an infection is, which can just be like a cold or asymptomatic, versus serious disease, which will bring you into the hospital. And like you said, Asieh, have you need extra ventilation, extra oxygen, and you can possibly die. I know it sounds like a broken record, but the data is playing itself out in this country as we speak.
What about kids under 12, Peter? How concerned are you about them because they are not vaccinated yet? And what is the best way to protect them?
So kids under 12, I know with the reopening of many schools now in the country, parents are worried. But even with Delta, they are still less likely to acquire and to transmit disease. From previous work that we've seen in kid transmissions in schools, first of all, the school is safer than the community in a surge environment. The strategy is really to build a wall of bodyguards around the kids, which is to immunize the adults. You form this wall and you ring a ring of immunity, so to speak. That's the best protection for the kids.
What do you think about the strategy? New York is going to implement it soon, basically asking people, requiring them to show proof of vaccination before they can go inside restaurants, bars, gyms. I think France and Italy are also doing it. And I think some parts where you are, if I'm not mistaken, San Francisco Bay Area, they're also implementing those measures.
Yes, definitely. It sounds like businesses are indeed caught between a rock and a hard place. Right now, people are afraid to go out to dine indoors. They're afraid to patronize businesses because of the surge. So in France, interestingly, once they did this, sure, there were a lot of protests, but it immediately resulted in 1 million individuals in France getting vaccines and 2 million shortly afterwards. So it will be an interesting experiment to see in the Bay Area. The Bar Alliance, which represents many of the bars in the Bay Area, have voted to enforce vaccination status or testing as a entry criterion before. So we'll see what happens. And like you said, certain restaurants have started that already. I just went to Hawaii. In Hawaii, they've been doing this for a while, and there hasn't really been any decrement in business.